I'm Dr. Nigel Steve Omollo. I am a thoracic and cardiovascular surgeon who is working here in Mombasa. So we have just completed a case, an interesting case, a vascular case, a patient who had something called aortic aneurysm. Basically, aortic aneurysm is a bulging of the aorta in our body, and it's a case that we have handled here in this hospital. It's the first of its kind case we have handled in this hospital. So just to tell you about this case, we have done an elderly man who, it's usually an incidental finding where we have the aorta. Aorta is like the biggest artery in your body. So sometimes it can actually swell, and this swelling is what we call the aneurysm. So we can have it swelling in different points. We have it either in the thoracic region, this way in the chest, or in the abdomen. In the case that you have just handled, this was a swelling in the abdomen. And the reason why we have to do the surgery is the swelling can be, it's like a balloon which has swollen and the wall becomes weak, and the patient can be at risk of rupture. Or if it ruptures, there will be severe severe bleeding which can lead to death. So we did handle this case here, and it has gone well. We have actually finished it okay, and the patient is being taken to the ICU. So just to dwell on this case, some of the risk factors to have aortic aneurysm is like smoking is a risk factor. Just being male, we are more like 4 to 6 times more at risk to get aortic aneurysm than females. Then if you have a family history of someone who has a similar disease, you are also at a higher risk to get it. And there are some conditions that if you have, you are at a risk of having aortic aneurysm. If you have some of like infective symptoms like syphilis, TB can also cause that. If you have atherosclerosis, this is where you have your blood vessel is being narrowed and also having some hardening plaques that are forming in the blood vessel. So this causes the blood, the arteries to actually become swollen, and you can actually lead to aneurysm. Also, there are some connective tissue disorders which, if somebody has them, you have a higher risk of developing this kind of disease, like the ones who have Ehlers-Danlos syndrome and even Marfan syndrome. So it's usually an incidental finding when you're looking for something else, and then maybe an ultrasound being done on you, and then they get the aorta actually swollen more than normal. And they're usually a cutoff, so that we say this is the area that we have to do the surgery, and this one you can actually look at it conservatively. The other thing that is of note for this kind of a condition is when you have this swelling, the aorta can actually split. The split, we mean that we call it dissection. It's where the walls they split, and then the blood is moving through the walls, and this usually causes some severe pain, and this now comes in as an emergency. Or also we can have even a slow leaking. There's an area which can actually start, the blood starts leaking out of the blood vessels, and we have to do it as an emergency. So basically what we do, we actually replace, depends with the modality of surgery that we want to do. We can do an open surgery, like the one we did for this gentleman, or we can do an endovascular surgery. So open surgery is where we open the abdomen or the area where it's affected, and we replace that area of the aorta with a graft. Endovascular is where we use something, we access the area inside the lumen of the blood vessel, and then we go and keep a stent or a graft around that area to replace that place that is bulging. So it's a serious condition that if you get it as a person, or you are referred to see a vascular surgeon or cardiothoracic surgeon, so that we handle it, and we are actually capable of handling that case in this area. And that's not the only case that you can do here. We have also the thoracic cases, and we have also a lot of other vascular cases that also can be handled in this hospital.